Hi, everybody. Jeff wanted me to be controversial, so I'm going to be a little bit controversial. So now you know why I don't look like Ted, right? Okay, so I was in Hong Kong last week for a few days, and I took this photo, which I thought was really interesting, the Fat Meat Company. So I'm jet-lagged as well. But so I'm going to talk about who benefits financially from low-carb, high-fat. And clearly, the insurance industry is kind of one of the key industries. But I'm going to talk about some others as well. Before I start, though, I want to say a few words about Tim Noakes. So he got mentioned yesterday. Zoe mentioned him in very high regard. He, in fact, lectured me when I was a student, and he lectured me on that horrid Krebs cycle. And at that point in time, he was not a low-carb person. And he had written The Law of Running. He was a great sports scientist, and he spoke about carb loading. He spoke about drinking Coke when you were running marathons because it really hydrated you well. And so yes, he's an A1 rated scientist, he's a lovely guy, but I have immense regard for him because he could admit that he was wrong. I want to thank the organizers and the attendees, because obviously without the attendees this wouldn't have happened, and I want to thank Ron and Jeff for inviting me to speak. I think I kind of bullied my way in a little bit, but anyway, here I am. And it's astonishing, right? Because I follow a lot of the low-carb stuff. I'm not one of the low-carb superstars. And to be in a room, and there are probably 20 of you that I could point out individually, and I think most of the audience knows who those people are. And this morning I was sitting over there, and I sent my wife a message. So she's in Zurich. And I said, I'm sitting between Gary Fettke and Jason Fung. And she wrote a message back and said, do they know that they're sitting next to you? Which, thanks, Gary. So that was really sweet. Yeah, so one of the things I wanted to talk about, or just mention, because it's obviously not part of the topic, is, so they've got a saying, you may have heard it, and we use it a lot when we price risk, and we have a whole lot of people working on a concept and how risky is it. And if everybody's kind of on the same page, it's a concern, right? And they talk about you're all drinking the same Kool-Aid. So you kind of just, you're not seeing it from the other point of view. And Kool-Aid's probably the wrong thing to use with this group. So I spoke to my sister, who's a huge low-carb fanatic, and she said I should use the word echo chamber. So this is a bit like an echo chamber. And when you have the Q&As, it's very friendly, right? There's very little challenge. And that's great, because clearly we all agree, right, on a really basic level. But I think it's good to have challenge. It's good to have difference. And to argue about things, because that way we can prepare ourselves for the outside world. And then the final thing is choice. So one of my big gripes is we talk about, I mean, certainly there are a lot of clinicians here that have patients that are very sick, that get helped. But, you know, we've got half the world that's pre-diabetic. We've got 2/3 of the world that's overweight. And being obese and being diabetic is not great. And I think it is so unfair that those people simply do not have a choice because they aren't informed, right? I know that drinking this is really bad for me, right? And I can make a decision about what to eat, how to eat. And the fact that those sick people can't is really unfair. So my aim in life is to give people an informed choice. And I think David Unwin mentioned yesterday, he always talks to his patients, do you want to have medication for the rest of your life, or do you want to change the way you eat? And they all choose that, but at least they can choose, and they know what the right thing is, right? So, okay, so that's my philosophy slide, done. Quick few words about Swiss Re. So we're 153 years old, headquartered in Switzerland. We're the number 1 or number 2 reinsurer in the world, depending on how the year has gone. The other one is Munich Re, huge reinsurer based in Munich, surprise, surprise. So we're a big company, and we do 2 types of reinsurance, P&C, property and casualty. So that's things like boats and airports and cyber risk and all kinds of weird stuff. And we do people, right? And it could be health, it could be disability, it could be life insurance. We're a very global company. We have about 10,000 employees, over 70 offices globally. It is a concern of mine. Yesterday when Jeff was asking who from different places, that there's no one from Asia here. So Asia is a huge growth market. They're, 63% of the world's population is sitting in Asia? Yeah, but he's not here. And we want more than just Dr. Yang.
He's here.
Is he here? Did he arrive? Great. So, it's really important for us that it becomes global. And as a company, I'm quite proud to work for Swiss Re. A lot of people see insurance companies negatively. Swiss Re's got an amazing vision statement. We make the world more resilient. So to me, when I talk to the very senior people at Swiss Re about low carb and about what it can mean for humanity, right, it really fits well with our vision. And you can see there, so that's our home page. And, we talk about, so on the first, it's kind of a rolling headline. The first thing is the 2016 results, $3.something billion. But the next slide is about, helping farmers in Kenya. So our vision, we really kind of live our vision. What's reinsurance, right? So it's a really tough thing when you meet people and you say you work for a reinsurer. They look at you with a blank face and they nod and smile, and they have no idea what a reinsurer is. So reinsurance is simply our clients are the life companies, right? The insurance companies. So any big insurance company that you can think of, they are our clients. So they reinsure part of their risks with us. Just like you as an individual would have your risk insured by an insurer, they reinsure part of that risk with us. Why do they do that? There's volatility, right? If it's very, very volatile, they're very concerned. So if you insure 1,000 people for $1 million each, that's kind of okay if you've got the capital. But if one of those people wants to be insured for 100 million, which we get sometimes, that could really screw things up, right? That person dies and you're in big trouble. So insurers would reinsure that with us. Regulators require you to have a lot of capital. So you've got to have capital aside. And if a company wants to expand, use their money to buy other companies or to expand in new markets, they can't do that if their capital is tied up. So by reinsuring, they can release some capital. Also unknown outcomes, new risks come along all the time. And then diversity of risk, right? So we heard yesterday, so it's good to have diversity in your gut flora. And diversity of risk allows you to hold less capital, because a bad thing that happens in, say, in Central America, right? A bad earthquake, it's unlikely that you're going to have bad earthquakes happening all around the world. So if you're big and you reinsure lots of different stuff in lots of different places, you need to hold less capital. And that's clearly where we fit in. So the key topics really is who benefits with the current status quo, who will benefit if the world shifts to low carb, or should I say when, what is insurance, looking very briefly at life and living benefits insurance, and then to get a key concept across to you is that we make risk decisions that are locked in for decades, right? And we price things for decades. We can't change it. And we make all kinds of assumptions, and there's huge amount of pressure, competition. So things are kind of priced very close to break even, right? So there's some profit there for shareholders, but really that's where it is. And that is set for the next 50 or 100 years. And if we make a mistake, it can be quite bad. And then I'm going to highlight the questions I'm often asked internally at Swiss Re. So I'm trying to convert Swiss Re as a company. It's a slow process, as you would know from other people. And then really, finally, just how the insurance industry can benefit. So the status quo, right? Who benefits? So I've picked on the UK. I could have picked on a lot of countries. I've got that little arrow there for salt, because that's one of my gripes too. But, you know, just a little bit of saturated fat, plenty of starchy foods. It's just astonishing, right? So who benefits? So we know that the people that make food and that sell food, the supermarkets, so big food, they benefit. I love the way they use grass for everything, and they use organic and wholesome and pretty things like that. So the people producing food, the people that are treating obese and chronic illness, right? Or the industries. So of course you've got big pharma, you've got medical device companies, you've got doctors, right? Private hospitals make a fortune. And then of course when people are obese, the food industry again comes along and sells them low-fat stuff, right? And then the diet industry is just fantastic, because people just keep trying to lose weight and they fail. Why? Because they're hungry and they're not doing a low-carb, high-fat diet. And then from an insurance point of view, the other entity, I don't want to say that benefits, but that wouldn't mind the status quo, is the pension fund and the annuity business, right? So if somebody retires, you've got to pay them till they die. If everybody suddenly became very, very healthy, they're going to be in a lot of trouble. So at the moment, it's kind of, you know, it's okay as things stand. And if people get sicker and die sooner, it is not necessarily a bad thing for them, right? So when I was in Asia last week, I went to Bangalore. So we've got an office there. And I went to a restaurant with a whole lot of my colleagues that work there. And there was an amazing, they had a grill on the table, lots of fantastic meat, all the good stuff. And then there was dessert, right? And they had lots of dessert and very sugary. And when I walked outside, literally outside the restaurant, huge banner across the street. India's #1 diabetes center is right here on your left. So, you know, just really highlighting who's benefiting from the status quo. All right, so who's going to benefit if the world shifted to low carb? Certain food segments. So all three of those photos were taken in Hong Kong. And I've heard people say, oh, you know, there's no real food in Hong Kong, there's no fresh food. Really? That's astonishing, right? And I really like the fat coconut company. I thought that was cool too. So Nina mentioned yesterday that people are often attacked by virtue of what their financial interest is, right, in low carb. And I think, so I've put a book there from Gary and from Robert Lustig, and they're not here, I don't think. So I thought, rather than put the books of many people in the audience that have published, right? So of course, there's nothing wrong with publishing books. Doctors help sick people and get paid for it, right? And I think we just have to accept and acknowledge that's okay. And we're going to get asked the question, and we're going to have to say, yes, absolutely, people have to earn a living, right? Just because they earn a living on something that they believe isn't wrong. So to me, it's got to kind of, elephant in the room, we've got to talk about it, and we've got to just say, that's okay, right? And acknowledge it, and not try and hide it. So certainly I know people, when they presented here, were very clear and transparent about their financial interests. So state health funders, right, like the NHS, I mean, if the world shifted to low carb, can you imagine the amount of money that they would save? And we know that the NHS is in huge financial trouble. I've got a colleague in the UK who spends part of her time working in the hospitals. It is a disaster, right? Absolute disaster. So the life and health industry, and I'm going to talk more about that. And then my favorite one is that who would benefit? Everybody on earth, literally, right? And if we can get dietary guidelines to properly change, that to me is the most important. So what is insurance? Insurance really is, you can't insure for something that's going to happen often, because then you may as well just save the money, right? It's got to be for something that's infrequent and that's a big loss to you, right? So something like medical insurance, Okay, depending on where you are and what medical costs are, and I know in the US, for example, you can go to hospital and end up $250,000 out of pocket. But in many places, you know, it's maybe a few thousand or $10,000 or $20,000, right? People could save that. So they don't need insurance for that. So insurance really is there for a big event. And so that's an example of a fire that burnt down a whole lot of houses. It's very unlikely to happen. You don't pay a lot, but you've got a lot of people paying that small amount, and then something bad happens, and those people can get a big compensation, right? That's the whole point of insurance. So in terms of life and health insurance, what big financial things can happen, right? So this is really, we do an insurance report in Europe every 2 or 3 years, and this is looking in different life stages, what people would have. So you could have medical insurance, maybe top-up insurance or private insurance, depending on what coverage you get in the country where you live. Disability insurance, which is probably one of the most important ones, because you don't need life insurance if you're single, right? And why? Who's going to benefit, right? Life insurance is there to cover your loss of income for beneficiaries that need your income, whereas everybody needs disability insurance, because when you become disabled, you can't work anymore, you can't look after yourself anymore. So disability insurance is usually important. Life insurance, critical illness is in many places in the world. It started in South Africa, in fact, and it pays out a lump sum if you get diagnosed with a critical illness. So again, it's a little bit related to medical insurance. And then there's some others, right? So something I heard yesterday was if claims increase, then premiums increase. What's the big deal, right? So what I've already mentioned to you is, so unfortunately, I found that picture yesterday. It's my daughter, and I realized she wasn't wearing a helmet. And I thought, that's really bad. But I don't think I was there on that day. So particularly those three: critical illness, life insurance, and disability. But life is by far the biggest, life insurance, and our rates are guaranteed for life. So if you're 30 years old, you take out life insurance, our very clever actuaries that work with me work out, you know, how many people are going to die, what's the mortality rate, and then they use something called mortality improvement, which I'll show you just now, because over history, people have lived longer and longer, right? So you price all of that in, and you assume, right, and that is what these people are going to pay. So if things kind of turn bad, nothing we can do, right? So in terms of increasing premiums, let's assume you could. That's also not a good thing if your company vision is we make the world more resilient, because this is just Asian countries. And if you look at the numbers, this is the life gap. This is in billions of dollars. So if you look at China, that's $18 trillion. That is the gap. That is the amount of life insurance that people don't have that they should have, right? And for Swiss Re, this is one of the world's biggest problems, right? Our business is insurance. When people don't have insurance, the industry has failed. So by increasing premiums, insurance becomes less affordable, which is not a good thing, right? That's not going to help close the gap. So now I want to quickly talk about this long-term thing and about placing bets or risk decisions over the next 40 or 50 years. So this is just randomly picked up off the internet. This is the Canadian Office of Financial Institutions. And so it's a bunch of actuaries, and the industry uses this. And what you can see, the graph on the right, that's survival curve, right? And you can see the survival curve. We know that it's kind of pushed out towards the top right-hand side. But not only have they got 2019, 25, 75, 2010, but then they start making projections. Because when you price something for the next 30 or 40 years, you have to guess what you think that survival curve is going to look like. And then if you look down at the bottom one, that's mortality improvement rate. And we use that all the time in the industry, right? And we price for it. And if you assume every year there's going to be a 1% mortality improvement, and somebody's now 40 years old, by the time they're 90, right, that you expect them to live a lot longer on average as a group, or a lot fewer of them would have died than when you started pricing them, right? Because there's this constant improvement. And you can see it kind of goes up and down, but then that's been projected all the way past 2030. So we've done this in the past, and we've looked into the crystal ball, and we've been very lucky as an industry. So what this graph shows is 65-year-old females in the US, how much longer they live, right? So whatever the number is there, you add it to 65, and that's the life expectancy. And you can see in the early 1900s, 12 plus 65, so kind of 77, right? And as we went along, the remaining years for a 65-year-old started increasing. And you can see the black line goes all the way to around about 1980. Remember what happened in 1980? So I can't make the Star Wars noise, right? So, but what you can see is these lines were the projections that actuaries made as to where they thought the line was going to go. And you can see that in 1952 they thought, okay, we've had a good run, things are going to calm down a little bit, right? They underestimated it. The improvements were even better. Then in 1966, they went, okay, it'll improve, but not quite at this rate. Again, they got it wrong. 74, the same thing. So that proved to be very good for the insurance industry because people were living longer than we assumed they would. So, fewer people died, fewer claims. It's all good. The price of insurance drops. Then, 1980 to 2000, the little black line at the bottom, that's what we observed. And you'll see that the projections we made in 1981 were too good. In 1984, they were too good. And we dropped our forecast in 95 and 2003. So for the first time, we kind of started getting it wrong, right? So the life expectancy didn't keep improving the way we thought it would. So now I'm going to show you a couple of studies that have come out in the last year or two. Different the studies that get shown here because, of course, we look, again, quite long term. But this came out in 2015, and this looked at these middle-aged white population in the US, and that their mortality improvements were, in fact, deteriorating, right? So you compare them to all the other countries, France, Germany, Australia, Sweden, you can see that they keep improving, whereas this group in the US was kind of, and there's quite a shock to everybody. Why is this happening? So they kind of tried to find a reason, and they came up with things like poisoning, suicides, the economy maybe wasn't doing very well. I'm not allowed to talk about politics, I won't. But, there were all these kind of unnatural causes that people thought maybe this is why. And then December last year, the CDC came out with the 2015 data. And if you have a look at the life expectancy in 2015, it's lower in men and in women than it was in 2014. For our industry, that's not good, right? Because that's not what we would have expected. So this is really bad news. Obviously bad news for us, but bad news for society. And then, then a study came out in January looking at this cause of death, this increased cause of death in middle-aged American, the white population. And interestingly, this is just popular press article that referred to the study, which I'm going to show you now. But you can see in late 1980s, there was this increase, right, with diabetes, which we've seen. And what they did was they went to go and look at cause of death, and they actually found that diabetes was 3 times as high as a cause of death than they had thought in the past, right? So We were sitting previously at around about 3 to 4% as a cause of death, and this study very much showed, and they looked at different data sources, that it was 11 to 12%, and in fact in obese people it was up to 20%. So it becomes very complex. So Ivor spoke about it. If somebody has heart disease, has a heart attack, right? Is that diabetes that caused that? Are they even tested for it? Do we even know it? So again, these are probably low numbers, but at least people are realizing that it's a lot more than we thought. So again, this is for Jason Fung. Diabetes is a chronic progressive disease. For goodness sake, the WHO says so, right? So the reason I'm showing this is, so they looked at all the different regions in the world, and you can see that there's this trend. We all know that, right? But typically what happens is we think of Western countries, and we think of the US and we think of the UK. And a lot of the data that we've seen in the last day and a half has been based on US and UK data. This is China. So probably higher because they do better testing, right? They test more people. But if you have a look at the top on the right-hand side of that graph, so that is the prevalence of diabetes, and you can see, depending on rural or urban, it's between 10 and 15%. That's China, right? And if you look at the bottom, pre-diabetes, half the population. So it's not just the Western world that we need to worry about, right? It's very much the Asian countries too. So the questions that the industry is and will be asking is, Jimmy, I'm sorry for this, but they talk about fad diets, right? Why do they talk about fad diets? Because there is so much noise around this. We have kind of funneled ourselves into this way of thinking, right? This low-carb way of thinking. We realize a lot of stuff is fad, and we kind of, I think we naturally filter out the noise. But for people out there, they hear the noise all the time. They get all these things about this butter and then, you know, this oil and then that oil, and then somebody has hot dogs for 3 months and loses weight. And the other thing people do is whenever you talk about diet, they personalize it. So they go, yeah, but my friend did this, or I know somebody who did that. And they cannot seem to get themselves to be in a unbiased, objective frame of mind to look at this stuff. And you've all had that, right, when you talk to people. And my colleagues and people in the insurance industry are no different, right? So I think I already have this huge label at Swiss Re. Oh, he's a low-carb guy. So it's like, oh, yeah, there he goes again. And it's very frustrating, but people do see it as a fad, right? Then, so this is my little bit, my bipartisan election picture that I've got up there. So certainly as an outsider to America, my view is that politicians tend to repeat the same thing over and over and over and over and over and over again. And if you do that, people end up believing it, right? And it's not just in the current milieu, it's been, I think, like that for decades. That's my impression. And of course, for 40 years, we've been told, like we've heard from Zoe, that fat is bad. Fat is bad. And I even find myself, as a complete convert, right? You sit with 3 or 4 fried eggs, lots of oil, and there's still a little part of me that's going, really? I mean, come, do you have it too? So, you know, if we feel that way, then it's really, really tough. And I struggle. I've got colleagues who I respect hugely. They're very curious, they're very bright, but they just cannot get this, right? It's just, no. So we're going to face that a lot in the industry. Then this is the typical thing I'm asked. What's the long-term outcome? Where's the study? Where's the 20-year follow-up, right? So Charlotte mentioned yesterday, you know, 2-year longitudinal follow-up. It's the longest we've currently got. But where is Where's the 20-year follow-up, right? We don't have that yet. So as much as it's so obvious, the biology is so obvious, the outcome, the HbA1c, the inflammation, everything else is so obvious, they want to know where's the data. And that's tough. Then persistency, because everybody who tries to diet fails, right? We all know that. And they go, this is just a diet. People are going to be hungry, and they're going to fail. No, they're not hungry. They eat a lot of fat. No, diets fail. What's the dropout rate, right? Then you go, well, yesterday there was a great Laura presented, fantastic study on lower dropout rates, people on a low-carb, high-fat diet. And they go, well, how long is that, right? So they've managed 13 months or 15 months, or are they going to manage 3 years or 5 years? Or they're all just going to go back to drinking Coke and having McDonald's, right? So I don't have an answer for them. Affordability, so that's a big thing that gets asked. People aren't going to be able to afford this new diet. So again, we've spoken about that in the last day and a half. And then this whole thing when it comes to Asia, it's that it's impossible for some diets to drop carbs, right? How are they going to not eat rice? How are they going to not eat bread when you're in India? And that's a hard one to answer, right? So you've got to be very close to the culture. And I've got an Indian colleague. She's a physician in Mumbai. And her concern is, how are people going to be able to afford to have a low-carb, high-fat diet on an Indian income, right? I don't know what eggs cost in India. And then, do we really know the mortality impact? So Amy yesterday had a great talk. I loved the DDT thing where they sprayed the mosquitoes and then they had to fly in cats eventually. And kind of the question is also asked, so how do we know what the effect is long-term on other systems, right? So we've been brainwashed for 40 years about fat being bad. So what's going to happen to the lipid profile? What's going to happen to, and we've all been asked that, right? But without very long-term data, it's hard to have an answer. So I want to show this to you quickly. This is a study by David Unwin. And he took almost 70 people who were diabetic or pre-diabetic, overweight, and he put them in a low-carb program. And you have the pre-intervention kind of parameters, and you've got the post-intervention parameters. This was for 13 months. And I took the average. So the average pre-intervention, average post-intervention, I put them into kind of what's called a rating calculator. So when somebody applies for insurance, if they're unhealthy, they pay more premiums, right? So before they went on this, you can see their premiums, for example, on the left for life, is 50% higher. So the risk premium would be 50% higher than somebody who was healthy. For critical illness, it would be 75% higher. For disability, it would be double, right? After the intervention, life, they'd pay what a healthy person pays, critical illness, a healthy person, and disability, 25% more, which is often rounded down to what a healthy person pays. So in 13 months, right, this is what you can do. It is astonishing. This slide really works with my colleagues because it's kind of insurance talk, and then they go, only 13 months? Okay, so last slide, how could the life insurance industry benefit? So to me, the biggest lever we have is we get nutritional guidelines changed globally, right? Just get them all changed. The whole world, 7 billion people, start living like this little group does, and the whole world's healthier, and everyone lives happily ever after. The other thing we can do is we can change the health of the obese and diabetic or pre-diabetic policyholders in our current in-force blocks. So every year, insurers sell new business. It's like that much, but they have an in-force book that is this big, right, of people that have policies and are going to have those policies for decades. You can't charge them more, but if you can make them healthier, right, so you can address the diabetic and the obese people in this huge block, get them to go on a low-carb lifestyle, then that can be huge. That can be really, really big for the life insurance industry. The other thing is when new people apply, right, instead of just charging them more, you can actually go, and of course there are companies doing this already. I don't know, I think in the US too, so Vitality, they kind of try and get people healthier, getting people to go to gym, getting people to lose weight, using the traditional guidelines, so that doesn't really work. But the concept is there, right? So if we have somebody who's diabetic and obese, instead of just charging them more, actually you can give them an incentive or try and charge them less if they go on this program. So that's a great way, again, to shift the needle. And then a final comment. So my focus has always been on life insurance because it's the biggest, but disability is a super important product. And I think if this low-carb thing can work, and I try not to talk about it too much. So we've heard lots of the stories about inflammation and all chronic disease and mental illness, and you know, there are huge benefits beyond diabetes and weight loss. And I think it could be that the disability claims would reduce dramatically if the world could go onto this low-carb program. I think that is a really, really big potential thing. And disability is expensive. So that means the price will come down and more people will get it, which is a good thing, right? So that's it. Thank you very, very much for your time.